Hello, my name is Dr. Dmitry Tsvetov, Temecula facial oral surgery, and today we're going to talk about a common issue that can come up in the world of dentistry, and that issue is how to replace a single tooth. We're going to discuss the options that a patient can have in that particular situation, and we're basically going to focus our discussion on trying to decide which is a better way to restore a single missing tooth. Is it with a dental bridge or with a dental implant? I'm going to do it with the help of the model that you see in front of you here. It's just going to make it easier for us to illustrate the topics that we need to cover. So let's turn our attention to the model, and let's just assume that the middle tooth right over here is the one that needs to be removed. So if we go ahead and remove that tooth, we end up in a situation where we have the tooth in front of the missing space, a tooth in the back of the missing space, and nothing in the middle. So the first question becomes, well, is this a bad situation to have? And I would make an argument that yes, indeed. If a single tooth is missing, it can cause a variety of problems. For example, the back tooth can start to shift forward. The forward tooth can start to shift back into the empty space. And more importantly, the teeth above can start to drop down lower because they will no longer have what we call the opposing tooth. So as a result, just because one tooth is missing, you can have potentially three teeth start to move and cause the misalignment of the bite or the way the teeth are coming together. So absolutely, in an ideal situation, the missing tooth should be replaced. So let's talk about what options we have as far as replacing this single missing tooth. Before the dental implants were invented, the only way to replace a single missing tooth would be to do a dental bridge. A dental bridge involves cutting the adjacent teeth so that they are ready to accept the bridge. So when you cut them, you're kind of circumferentially removing tooth structure around each tooth, pretty much cutting them into pegs, and then you can place a dental bridge, which is basically two individual crowns splinted with a fake tooth, what we call a pontic. So this achieves the goal of replacing the single missing tooth, but in the process it creates a number of problems. The first problem is that a dental bridge like this is incredibly difficult to keep clean. You cannot floss through these contacts in a regular way. So as a result, you have to floss underneath and through, and that's a very difficult thing to do. So as a result, it is not unusual for decay to start to appear at the margins of the crown here and over here. The decay at the margins eventually can lead to involvement of the pulp chamber where the nerve lives, which may mean that you will need a root canal on those teeth, or potentially a new bridge may need to be placed. And that's exactly what the literature tells us, is that on average, once you get the dental bridge placed, you will need to replace it every 10 to 15 years. Only half of the dental bridges placed last 10 years, and the other half tend to fail within that period of time. So in addition to that, you also have to keep in mind that you're not only potentially risking the damage to the adjacent teeth with the decay, but what's also happening is that the bone underneath this fake tooth begins to melt away, and it actually does so rather rapidly. So when you have the missing tooth in this space over here, the bone that used to be there supporting this tooth begins to melt away because it is no longer getting what we call mechanically loaded, or the chewing forces are not being transmitted to the segment of the bone underneath the fake tooth over here. And that's because the chewing forces are transmitted to this tooth and this tooth. So as a result, the bone over here begins to shrink or to narrow, and what you end up with is like an hourglass shape of the alveolar bone in this region. That not only affects the contour of the jaw, it also becomes a problem if, let's say, later on you decide that instead of, for example, replacing the bridge, you want to go with a dental implant, but you may not at that point have enough bone available to actually place the dental implant. And significant reconstructive procedures of the bone may be needed before the dental implant can be placed. So let's look at what other options we have as far as replacing a single missing tooth. And let's talk specifically about the dental implants. When you have a situation where you have, again, a single missing tooth and you have and you would like to replace it with the dental implant, it can be done predictably, easily, and without affecting the other teeth. When you look at the bridge, you are turning a one-tooth problem into a three-teeth problem. With an implant, you are treating a one-tooth problem with a one-tooth solution. So how do the dental implants work? Well, the way they work is that the outside coating of this implant is very friendly to the bone. So when the implant is inserted into the jawbone, what happens is that a physical bond begins to develop between the implant itself and the natural bone in your jaw. Now, once the implant has completely bonded to the bone, now we have a stable foundation or a platform for the placement of the crown or the white part of the tooth. So as you can see, the end result is the same. We restored the missing tooth. However, we have accomplished that without injuring or removing vital tooth structure from the adjacent teeth. We have accomplished it also in a way that makes it easier to clean in between with the flossing. And more importantly, we maintain the bone in the lower jaw or the upper jaw, wherever the case may be, by actually placing that implant into the jawbone. And now anytime you're chewing on it, the forces of chewing are being transmitted to the level of the bone, and the bone is being maintained. So just to summarize, advantages of working with the dental implants include preservation of the bone, ease of the hygiene, and not having to get the other teeth involved. With the dental bridge, you are cutting adjacent teeth into pegs, and you're making it more challenging to maintain good oral hygiene because, again, it's incredibly difficult to floss, and you end up having recurrent decay at the margins of the adjacent teeth. I hope this presentation has been very informative. I just would like to remind you that here at Temecula Facial Oral Surgery, we do provide free dental implant consultations. So if you are facing a dilemma as far as which way to go, dental implant versus a dental bridge, please give us a call. We'll be very happy to see you and discuss your particular case in more detail. Thank you so much for your attention, and we hope to see you soon.